You know, we celebrated 1 year of Martino TV last week. One of the first guests we had on the show, Dr. John Dishler, and he came to us as one of the most renowned Lasik surgeons in the country. We've had a great relationship. So many people have been helped by Dr. Dishler, and he brought one of his patients with him today, Julie Tamblin. She lives up in Dillon, Julie, and we're going to talk about your surgery and your case, but Dr. Dishler wants to challenge us to a quiz. I'll bet you I get it right, too. And I won't
That's right.
I really won't look at the answers.
You're not going to cheat? Okay.
I feel like I know you. Dr. Dishler, by the way, has been doing this. How many procedures now? About 50,
over 50,000 procedures and over 15,000 all blade-free.
All blade-free. And he has his own surgical center. It's very important that when you compare surgeons and techniques and procedures that you're comparing apples with apples. This is the latest technology. For example, your eyes, what were they?
They were 2070 to 2080.
2070 to 2080. So what other people could see at 70 and 80 feet, you had to be at 20 feet. Is that basically what it says?
You got it.
Okay.
You got it. That wasn't even in the quiz.
Right. So now what can you do?
I am 2015 to 2020.
So you're better than average right now. Did you ever think that was possible?
No.
So why'd you put it off?
I think probably for the same reason a lot of people do. It's my eyes.
Exactly.
If they're gone,
and are
that's
they
bad.
really? Is it really going to work?
Right.
So you found out about it through your husband's friend?
Well, no, my husband's been on my case.
Yeah.
For years. Just do this, just do this. Finally, I learned about blade free, and that made all the difference to me. And then my husband's cousin had his eyes done by Dr. Dishler, and I thought, okay.
And he's an athlete?
That whole family.
And you are too. What did you do that you, what was hampered by your vision?
Oh, dance classes were terrible. I would lose my glasses and trying to run with them and always pushing them up. And I have eczema, and I would get eczema underneath the eyepiece, and that hurts. So.
And things are totally different. You noticed it right away?
I know I am not supposed to admit to this, and don't anybody do this, but I peeked a little bit. In the first 2 hours, you're supposed to keep your eyes closed, and I would kind of peek a little.
Looked up, huh?
And I tell you, even then.
Were you amazed? So many people say that. And it's totally changed things. How long ago did you have them done?
About 5 weeks ago.
How was the care?
Fantastic.
Yeah.
I mean, they really, I told them, I only actually had to tell them once that I was nervous, but I told them a million times because I was nervous. But they got it instantly.
But we really don't exaggerate when we say it's an unbelievable experience, isn't it? They treat you like family.
Yes.
Yeah, unless you go there, you wouldn't know it. And they do give complimentary consultations. You went for a complete evaluation, right? With no obligation. Let's talk about the quiz.
Yeah, but before that, let me, anyone that comes in for a complimentary evaluation, even if they don't have the procedure, if they're truly a candidate, we'll give them a free iPod just like this one, and I'd like to give that one here to Julie, since she didn't get hers.
Now you got an iPod.
Thank you.
That's even if you don't have it done. If you're
very welcome.
If you're a candidate and you go for that complimentary consultation, whether you have it done or not, you get a free iPod. Let's talk. Okay, give me a quiz. Give me a quiz.
Oh, I'm supposed to ask the questions?
Yeah, I want to know. Lasik can treat any vision.
Can we treat any vision problem with Lasik? Any vision problem at all?
I would say yes. No, not everyone. Not
right.
There are tell the ones you can.
Well, we can't treat cataracts, glaucoma, other eye problems, but for any refractive thing, you're right. Yes, we can. We can treat nearsighted, farsighted, as one of the weathermen just asked me before the show. Astigmatism, we could treat astigmatism.
So really almost all of the ones that used to be a problem are no longer a problem. But of course, if you have cataracts and stuff, or an eye disease.
Medical things, we can't take care of that with LASIK, but anything that's for glasses or contacts, we also get rid of the little, marks on the end of the nose that people get from wearing glasses.
Now, I know this answer, okay, so let's go. And that, by the way, they highlighted presbyopia down there, which is normal aging of the eye. That can be treated successfully. I have it, and many people have had that done, so they can treat one eye a little closer, one eye a little farther away, and you can definitely focus. Your mind takes over. Okay, the first step in LASIK, creating a flap in the cornea is always performed using, well, I know, a surgical blade. It used to be that way, but you guys have lasers that do that.
All laser.
Explain
in fact,
that.
we use just all laser technology for everybody. In fact, we're the first center to offer that 10 years ago, and now we have 2 lasers that do all laser procedures.
So it's a much more accurate
It's much
flap.
more accurate, much more reproducible, much safer, no pain, quick recovery. We can do more people than we used to be able to do, because we can make thinner, more precise flaps, and the results are better.
Okay, so let's talk about this new Zeiss Visumax. Am I saying
right.
Visumax?
Visumax, right.
Visumax, the most advanced laser. Let's talk about that. We have some video of this. It's an all-laser LASIK?
This is the most advanced all-laser LASIK. It's being done by the Navy on their fighter pilots. It's approved by NASA for astronauts. We make the flap, and this is what Julie had with this first laser you're seeing right here. Totally painless, only takes about 20 seconds per eye. Patient doesn't feel anything at all.
That's for everything.
That's right. And then the second part of the procedure, patient stays there, bed moves under the other laser. That's another 20, 30 seconds. And then they're all done. They get up, they walk out under their own power.
It's amazing, right? Did you think it was going to be that? Were you expecting more?
Yes.
More trauma?
Yes.
Really? Mm-hmm. So when they said it's done, you're saying, wow, it's done.
Yeah.
Okay. Now, here's question number 3. Custom LASIK provides more precise vision correction. I would have to say true. Why is that?
True.
Though? I mean, it's custom. What do they mean by custom?
Well,
people say, Dr. Dishler, they're on a laser machine. What's custom about it?
Custom is tailored to the patient's particular eyes. Everybody's eyes are different. We program it specifically for that patient's eye, because this isn't just a technology question, this is a lifestyle question, and the bottom line is people want to have good natural vision. I mean, Julie was telling me she's a photographer, she has to have perfect vision for far, she loves to read. People have to be able to have good vision, far, near, in between, without halos, glare, all these other things. So,
and you can program a laser to do different corrections for different types of eyes.
That's right.
And people don't realize that. When you say laser, they think that's doing everything, but you still are there.
Right.
You're a surgeon and you're taking care of them. And that's what people need to know. It's not just putting you in a machine. And that's why it's important to have a relationship with the surgeon. Many centers or many places, you don't ever see the surgeon.
Right.
You go to a surgical center and you have it done.
Right. And that's why we've come back, you know, and we keep bringing nice people that have had this surgery. Here's an example of the video of the actual procedure being done. You can see the very precise flap.
And it's that fast. And you don't have to hold your eye completely still. It will track your eye.
It tracks it.
That's another thing that's probably had you a little nervous, but did you realize you could?
When I read about the femto laser, which is a very, very small portion of a second, that it would stop if and in fact, I did move one of my eyes.
If you move too much, it would just stop and pick up again.
No problem.
Right. And that's the great thing. People are afraid they're going to mess it up or something, but there's no way for a patient to mess this up. It always does it the way it's supposed to.
Okay, so let's talk about the laser. Okay, you're the first and only to offer the Zeiss Mel 80. What is that?
Well, along with the Visumax, as I said, the table spins around, and the other part of the Zeiss, and everyone knows Zeiss, great optics.
Yes.
The Zeiss Mel 80, that's the laser part that you just saw that does the actual correction.
Okay, so it's seamless to the
patient.
But you're
having
having two different lasers, one for the flap and one for the correction.
Right.
Okay, now we have a special offer, and let's talk about this. This is what we want to explain. The lowest guaranteed price for custom all-laser LASIK. You can say that confidently,
right?
Because you want people to compare apples with apples. You're talking about the same technology and the same correction.
Right. But, you know, here's a surprise to you, because not only do we guarantee the lowest price, we have 24-month financing, which you're going to mention, 0%, but we decided just yesterday as a sort of special that if people mention that they saw us on the show, they will get an additional 10% off.
Good.
Just an additional 10% off that price. They just need to call and mention that they saw this on Martino TV, and we'll extend that courtesy to them as sort of an anniversary for us being with you for a full year now.
Good. So if you mention Martino TV, you get 10% off already, the lowest guaranteed price for all custom LASIK. 24 months, 0% financing with approved credit. Now, if you go for a consultation, you're a candidate. You decide, you don't have to decide to have the surgery done or not, but if you're a candidate, just for going, for getting the evaluation, for finding out you're a candidate, you get a free iPod. Here's how you contact Dishler LASIK. Julie has her iPod. 303-793-3000. 303-793-3000. Online, it's dishler.com.